I'm Sheila Hoag, and I'm a senior researcher at Mathematica Policy Research in the Health Division, and I co-authored 3 articles in the December 2016 edition of the Foundation Review. In the first article, which I wrote with my colleagues Debra, Lipson, and Victoria Peebles, we review key findings from our evaluation of KidsWell. KidsWell was an advocacy initiative sponsored by the Atlantic Philanthropies that ran from 2011 to 2016, and it theorized that if advocates in 7 states could leverage new funding and coverage opportunities made available by the Affordable Care Act, that they could increase the number of children with health insurance coverage in their states. In fact, we found that over the period we studied, the number of children in each of the states with health insurance coverage did increase, thanks in part to policy changes that the KidsWell advocates promoted. When we interviewed state policymakers in each of the 7 states, they confirmed that the KidsWell grantees had either a moderate or large influence on the policies passed, although they noted that other factors in the states, like the state economy or state political issues, also played a role. In the second article, which I co-authored with my colleagues Leslie Foster, Mary Harrington, and Debra Lipson, we draw on nearly a dozen years of our shared experience evaluating major consumer health advocacy initiatives for the Robert Wood Johnson Foundation, the Atlantic Philanthropies, and the David and Lucille Packard Foundation. We highlight challenges that we've faced evaluating health advocacy campaigns and how we've overcome them. I think the main takeaway from this article is how essential we think it is to begin any advocacy evaluation by articulating a theory of change. In this way, everyone is on the same page about the expected outcomes and how the campaign is expected to achieve them. In the third article, which I co-authored with my colleagues Jennifer Lyons, Cara Orfield, and Sonya Streeter, we draw on lessons learned from evaluations of 2 state technical assistance programs offered by the Robert Wood Johnson Foundation to draw out recommendations for other funders considering offering technical assistance programs. We recommend funders consider a variety of areas if they're going to offer technical assistance, such as grantee composition, whose priorities will shape the technical assistance agenda, and some evaluation methods to consider for deciding whether or not technical assistance offered has been effective.